thank you very much. First thing first, I would first of all like to express my sincere gratitude to the Slovenian Ministry of Health and to the Institute for Public Health for the leading role they have played in the coordination of the European Partnership for Action Against Cancer, this joint action, as well as to all the partners for their invaluable contributions and for their continuous engagement. And we have seen very clear examples of this over the past day and a half. At the closure of this open forum, I would like to focus, of course, on how the EU, the European Commission, sees the added value of this partnership, and also to say a few words on the future perspectives for our work on cancer. In the past 3 years, this joint action has brought together European stakeholders with a common aim and the commitment to reduce cancer with around 140 partners from across Europe. And as we have heard, a tremendous amount of work has been completed, covering a very broad range of activities, and much of this has been presented over the last 2 days. It's very clear, in my view, that by engaging relevant stakeholders across the European Union in a collective effort, the results of this partnership illustrate a strong political commitment of the partners, and in the sense, it is also a very good inspiration for our future work at EU level, not just in this area, but also in other areas as well. One of the success stories of this partnership are undoubtedly the national cancer plans. The work carried out in EPAAC has brought most member states within reach of achieving the European Commission's objective of having an integrated cancer plan by 2013. And as we know, 24 member states now have functional plans in place. I'm also very encouraged that member states have also readily participated in the efforts to compare and describe the elements of these plans. I would very much express my hope that we will very soon have cancer plans in place in all 28 member states. This is the objective. We are almost there, but we are not yet there. The Commission is always ready and willing to offer our support to the member states which still require it, and the material developed in this joint action will no doubt also be very helpful in this process. The existence of a cancer control program signifies above all that ministries of health and other health system authorities have made a commitment to tackle their country's cancer burden in an organized and coherent way. And continuing on this path, our hope is that national cancer control programs become synonymous with quality cancer services. In the coming years, we will need to work together to sustain this momentum on EU activities in cancer, building on the results of this joint action. As you know, next year, the Commission will launch a new joint action on comprehensive cancer control. This is currently being prepared with the member states and will have two main objectives. First, to identify key elements and quality standards for cancer control in Europe. And second, to facilitate cooperation among member states through a platform for member state cooperation. This will include the exchange of best practices, as well as identifying and defining key elements to ensure optimal cancer care. Let me assure you, the European Commission remains fully committed to an increasingly efficient and effective EU cancer control policy. Cancer will remain high on the European Union's agenda in the coming years. I would say now it is a permanent feature of our policy. And let me just raise a few key points in this respect. Next year, we hope to launch the revised edition of the European Code Against Cancer, which will be based on a direct grant to EPAAC. The code, which should be based on the strongest possible scientific evidence, will be a centerpiece in our efforts to raise awareness about cancer prevention and early detection across the EU. And already today, I would like to call on all institutions and organizations present here to support us in disseminating the code. We have also renewed our commitment to cancer screening by asking the Commission's Joint Research Centre to take forward the development of a new edition of the breast cancer guidelines, which would be linked to a voluntary system of accreditation for breast cancer services. Revising the guidelines is a matter of urgency. We are therefore working closely with the editors of the 4th edition of the breast cancer guidelines to ensure that urgent revisions are being presented as supplements in a short time frame. In the field of research, the EU 7th Framework Programme for Research has invested around 1.4 billion euros to support cancer research in the period between 2007 and 2013. These are financial resources unmatched by any previous research framework programme to support this area. For the period between 2014 and 2020, Horizon 2020 is the new EU research and innovation programme with an ambitious budget of 79.4 billion euros in total. There will be opportunities for cancer research in all three proposed pillars of Horizon 2020: excellent science, industrial leadership, and societal challenges. It will help European researchers to take decisive steps towards the development of a comprehensive and coordinated effort on lifelong health and well-being research in Europe, including initiatives jointly implemented by the EU and its member states and/or the private sector. Among the societal challenges, the health, demographic change and well-being challenge will follow a problem-solving approach and will address prevention, diagnosis, understanding and treating disease, as well as promotion of integrated care. And this challenge will be particularly relevant for cancer research. Cancer work has to be underpinned by a reliable cancer information system, as we have heard. And this is now being coordinated in our joint research center, and we are confident that this new system will give cancer information a solid and sustainable and permanent base for the future. As you know, in order to ensure overall coordination and coherence of cancer work, Commissioner Borg intends to relaunch the EU Expert Group on Cancer Control next year. This will enable member states, in cooperation with partners and stakeholders, to influence the overall picture of EU cancer work and also to steer developments at strategic level. I think it is clear from what we have heard that we do need to pay special attention to this strategic element, to ensure synergies with other areas, as we have heard examples yesterday, and also to make the best possible use of tools, new tools we have, such as the systems provided under the Cross-Border Healthcare Directive. To conclude, the European Partnership for Action Against Cancer has, in my view, clearly and abundantly illustrated the tremendous potential that a collaborative approach has in the response to common challenges. And the EPAAC joint action showed many cooperation and collaboration practices and has resulted in many synergies. The fact is, member states are stronger together, and in the case of cancer control, they have the means to construct a project that is much more than the sum of its parts. The Commission will issue its report on the partnership next year, but already today, I think it is very safe to say that our strategy to give new impetus and priority to cancer as one of the major chronic diseases we are facing in Europe today has been very successful. I hope that we can continue to work together to fill the partnership with life and to achieve tangible results. And in this respect, I would also hope that our work on cancer serves as an example of how EU cooperation can add value, and I'm sure it will provide inspiration, it has already provided inspiration, to work on chronic diseases more generally. And in this context, I look forward to a strong contribution from the cancer community to the Chronic Diseases Summit we will organize in April next year. Thank you very much.
It's a great pleasure to be able to address you at this final Open EPAAC Forum. I had the privilege to be a part of the very small task force when preparing the teams for the Slovenian presidency in early 2006 and 2007. And when we agreed that the cancer will be our main health priority, we could not imagine that today we are summing up so many initiatives under the EPAAC. Of course, we had great support from the member states, from the politicians, from the Commission, from the European Parliament, experts, and also the civil society. And I agree with those who already said that the partnership or the EPAAC was the great success. But they say that a picture says 1,000 words, so I would like to invite you to watch a video to sum up a few images. and which documents some EPAAC events. So please, if we can watch the video.
The cancer burden in member states of the European Union has been on the rise for well over 30 years, with further increases expected in light of projected population aging. Policymakers and experts in Europe have long been working together to help address this growing public health challenge. The European Partnership for Action Against Cancer, termed EPAAC, is one of these initiatives.
More than 300 people attended the launch of the European Partnership for Action Against Cancer in Brussels. Its target, to reduce cancer levels by 15% between now and 2020.
This is one of the best projects ever launched by the Commission and is definitely strengthening the hope of the cancer patients across Europe.
It's the most important thing that has happened in the cancer field for the last 20 years, I can tell you.
The EPAAC joint action began in February 2011 and gathered together 36 associated partners from across Europe and over 100 collaborating partners from around the world to provide a joint response to the growing burden of cancer. EPAAC partners enlisted the help and participation of a wide range of stakeholders, including European and national policymakers, health professionals, researchers, patient groups and citizens. Together, they collaborated in different ways. They attended meetings, presented the partnership at conferences and workshops, and contributed to scientific publications. EPAAC partners made up plans of the activities they would carry out through the partnership. Together, they organized innovative promotion and prevention activities such as flash mobs and youth poster competitions, started a school for screening management training, developed European networks in cancer care, initiated pilot projects to coordinate research, designed the structure of a future European cancer information system, launched an online social campaign for cancer prevention, and came within reach of achieving a national cancer control program in all member states, and will produce a guide to aid member states in achieving a high standard of quality for national cancer control programs. Throughout EPAAC, partners have experienced their share of challenges, debates and insights, and even made some new friendships along the way. The partnership provided opportunities for new collaboration and networking. Building on these experiences, partners are looking forward to collaborating in the next joint action on cancer to advance efforts in comprehensive cancer control, which should lead to a decrease of inequalities amongst cancer patients and help provide better access to cancer care for all European citizens. EPAAC has shown that partners and member states are stronger together and can build frameworks that are stronger than the sum of their parts. This is a lesson worth remembering throughout all our joint work in the future.
I'm very happy that Slovenia, almost among the smallest member states of the European Union, was able to contribute so actively to this partnership and in this way collaborate with the wider European community. Although many things has been done, more work lies ahead. And we also heard yesterday and today that there are so many challenges, so many new initiatives, so much work which has been started and should be continued, that we really need to find a strong a strategic and intelligent way how to work and how to continue to work together. One of these opportunities for collaboration will be the next joint action on cancer, and in Slovenia we are proud to continue to help new partnership for the benefit of all European cancer patients and citizens also in the future. Of course, I'm very glad that I heard so firm commitment from the Commission to continue to support and find even new ways how these many initiatives will come through. In the end of gathering in these 2 days, I would like really to sincerely thank, first of all, Commission to be supportive all the time. I would like to thank you all project leaders and the very dedicated team at the National Institute of Public Health who did all work of coordination and also with organization of this event. I would like to also thank the staff from the hotel and technicians who made our work so feasible. And of course, I would like to thank you who have been here, contributed so actively in this event, and I would welcome you again in Ljubljana, and I sincerely hope that we will meet together, working together, and spend, I hope, enjoyable time. So I would like to conclude this meeting by just saying hello to all friends and have a safe trip home, and hopefully we will see back in Ljubljana or in other maybe cities, one of the other nice cities in Slovenia. So thank you very much for your contribution and for the work you have done. Thank you.